Online as well is Dr. Dorian Smith, Medical Officer of Health for St. Thomas, and Deputy Superintendent of Police Fitzroy Williams from St. Thomas. We begin our conversation with the update from the Minister.
Thank you very much, Stephen. Good evening to our listeners online and to all in the room. Welcome back to the Chief Medical Officer, Dr. Bisesa Mackenzie, who was off on badly needed break. And she's back now, energized and ready to work hard non-stop for the next year or so. So I need to take my break now. And of course, the PS is here. So we're going to be focusing on St. Thomas today, but we'll give an update generally on the COVID situation in the country. This is our COVID Conversations, weekly Thursday evening, and we hope to provide ongoing information to the public and give, of course, our media partners an opportunity to clarify any issues. We think it's very important. But firstly, let's begin with Dr. Bisesa Mackenzie, who will give an update on where we are now as a country using her usual graphs and charts. Dr. Bisesa Mackenzie.
And good evening, everyone. We're able to see the slides on the screen. And so as of today, our present situation is that we have 9,373 confirmed cases, 499 that are imported cases, and 8,874 cases that are locally acquired. And we can see the map of the cumulative number of cases on top, and the map at the bottom gives us the numbers of active cases. So we actually have 687 cases for the period October 21 to November 4th, 2020, which would represent the 14-day period, and these would be our active cases. Next slide, Stephen. Okay, this map gives you a closer look at the communities, the active cases by communities. That is up to November the 4th, and we can see that right across the country we have cases that are in our communities, and in particular in St. Catherine and Kingston and St. Andrew we're seeing the heaviest burden. But certainly now we are noticing that on the northern and western side of the island that we are seeing more active cases, and we're seeing that the cases are lessening in the southwestern parishes and also in the eastern parishes. This is our epidemiological curve, and we can see our trends that are depicted here, and where we saw that we had a peak at about the end of August, a plateauing over the month of September. We can see that for the month of October, we have been consistently trending downwards. Now, I just want to say that the epidemiological curves gives us an idea of trends. It does not give us absolute numbers of what is happening in the country, because the curves are always, the tip of the iceberg that we are seeing. And while it is that we note that we are seeing a trend down at present, we still have to remain in a position of high alert and caution as we approach what is going to be a very busy time of the year, the Christmas season. Next. If we look at the different parishes, what we can see is that in some parishes, the picture represents closely what is happening nationally. So we can see over the last month that we would be seeing a trending down in the number of cases in Kingston and St. Andrew, and in St. Catherine, in St. Thomas, in Portland. Most of the parishes, St. Elizabeth, Manchester, Clarendon, we're seeing a general trending down. I just want to bring your attention, though, to some parishes that have been inactive over the last couple of weeks, but recently we have been seeing an increase in the number of cases. So, for example, Westmoreland, We have been seeing an increase in the number of cases in Westmoreland, and also we have to take note of what is happening in St. Anne. As I had said previously on the maps that we've had before, we're seeing a lot of activity now in the western and northwestern parishes, and so we have to pay close attention to what is happening there. This is our weekly positivity rate, and we can see that the weekly positivity rate peaked at about the epidemiological week 38. We are now at epi week 45, and we can see that we are plateauing. We have trended down over the last month, coming down from 24 to 10, and we have been plateauing at 10 for the last 3 or so weeks, and this week suggests that we're going to be along the same trend. Now, our hope is that we will continue to get that positivity rate down. This is where we look at our number of deaths. Unfortunately, we have seen up to over 200 deaths now as a result of COVID-19. But the good news is that while we had a peak of those cases in August, at the end of August going into September, we're now seeing a trending down, and we hope that this trend will continue. The next set of slides are going to give you an idea of what has happened over the last 16 weeks. And we're just going to, you could just flip through those slides and you can see, starting in July, how our cases have increased to involve the different parishes. As we move through time, we would have seen that the number of parishes would have been affected more and more, and the density of the cases in the parishes would have increased. If we stop here a minute and just go back to the first week in September, about 2 slides back. Oh, you can't go back. All right, sorry. Okay, then we keep going forward then, and we see that we had gotten quite dark in some areas, and now we are starting to see a lightening up in some of the areas as we go through October. So we definitely can see that there has been an improvement in the numbers that we have been seeing across country. I must say that we have at each month we do an analysis of what is happening, and we do change our strategies to match what is happening in country. We, at the beginning of October, we had started to do a variety of community interventions, and we believe that this has worked to decrease the number of cases again. And as we go into another month, we are looking again at our strategies, how it is that we decrease even further. Next. This is the confirmed COVID-19 cases and the deaths by age. And again, as I said, very unfortunately, we've had 217 deaths up to now that are COVID deaths. The populations that are mostly affected as we increase in age, so the 80 and over population, we have a case fatality ratio of 20.2, 70 to 79, 14.1. While in the younger age groups, we would have a lower case fatality ratio, and that would be the number of deaths over the number of positive cases in that age group. Again, not only are the elderly more affected, but we notice that men have a greater case fatality rate compared to our women, with a 2.9 versus a 1.9. So this is also of note. So the elderly and the male population are heavily affected. In terms of the parish distribution of the deaths, we would notice that also we can see that there are some parishes that are more heavily affected. And in these parishes, of course, we have to consider that we have some parishes that are more dense and therefore will, by virtue of that, have more cases. But then we also have some parishes that would have an older age population, and they may be more heavily affected as well. So this is what it looks like with St. James, St. Mary, Kingston and St. Andrew, St. Catherine, St. Elizabeth, and Westmoreland being the parishes where we would have seen most of our deaths. In terms of the COVID rates by community, this is a very important comparison for us to look at. The top map shows us what has happened over the time since March until now in terms of the communities that are affected. And what we can clearly see is that almost every single community across the country has been affected, compared to now, which is the map, the lower map, where we see that many of these communities now would have no active cases. But it's important for the population, again, to recognize that when we talk about numbers, we talk about trends. The number of cases that we're seeing are indicative of the trend of what is happening, and it's not a reflection. It is a reflection, but it is not the absolute number. And so it's important for every community to recognize that they have had positive cases, and therefore their risk is just as real, and therefore the precautions must be taken by everybody and not just in the areas that are having active cases now. And this is our last slide, where we look at the communities, the top 20 communities with active cases now. And you would recognize, if you remember the slides in the past, that this is a big improvement compared to slides in the past, where looking at similar picture, we would have seen more reds in terms of the active cases. So our communities that are heavily affected, downtown community, where we have 75 cases, and I must say that this is associated with a cluster of cases within a nursing home, and it is not that the cases are widespread throughout the downtown area. So, and that's in all of these areas, these 20 communities with active cases, the largest number of active cases, we have active interventions going on. So we are out there in these communities with our health education officers, our surveillance officers. We are mounting different interventions to educate the population, to ensure that we contain what is happening and to keep our numbers down and to reduce exposure within these communities. That's the update. Thank you, Minister.
Thank you, thank you very much, CMO. I think the general consensus, therefore, is the maps, the charts, and by extension, the picture on the ground is pointing in the right direction, which means an improvement week over week, at least for the last number of weeks. But again, the message has to continue to be sobering that COVID is still out there, it's still present, in less communities now based on testing and surveillance, but we cannot afford to be complacent. And at some point, I'm going to want the CMO to comment on what is happening around us as a country, because I think that brings heavy bearing on not just our capacity to control internally, but the likely impact and influence, especially going into the season of good cheer, where we anticipate relatives, family members, friends visiting, what that poses in terms of potential challenges and how to mitigate against that. But before we get there, I wanted to just look now at the Southeast Health Region, where St. Thomas the Parish falls, where we'll place some emphasis later on, and ask Dr. Sandra Chambers, our Regional Technical Director, for a very quick overview as to what is happening in this region. This has been the most active region because the stakes in the Kingston and St. Catherine and St. Andrew, and then of course St. Thomas. I think it would be good to give a quick overview, and then we move right into St. Thomas. Dr. Sandra Chambers, you're online.
Yes, good evening, Minister. Good evening, CMO, and good evening to our public in cyberspace. I just want to take the opportunity now to give you a quick overview as to what is happening in our region. So Southeast Regional Health Authority provides service to over 1.2 million persons, and that is 47% of the Jamaican population. We have the largest region in the island. We are comprised of Kingston and St. Andrew, which has over 662,000 population. St. Catherine, 520,000 population, and St. Thomas with the smallest population of over 94,000. We provide services through 92 health centers, 9 hospitals, and these are the largest hospitals in the island, 5 of which are specialist hospitals. We are looking now, as of the 4th, our cumulative cases. So Sarah would have, as of yesterday, a total of 5,776 cases. That is our cumulative cases. And that would be 61.8% of the total cases in Jamaica. So we have the largest share of all the positive cases. We would have had 304 active cases. That's over the past 14 days. We would have recorded 118 deaths. 105 are directly related to COVID, and that is 48.4% of the total deaths in the island. If we look at KSA, we see that KSA has the largest burden of cases. Over 56% of the cases in Sarah are from Kingston and St. Andrew, followed by St. Catherine with 37.3%. And St. Thomas, the smallest area, has 6.6%. The largest number of deaths, however, are also recorded in Kingston and St. Andrew. They would have 55% of the 105, 55, sorry. And St. Catherine, 47. St. Thomas only records 3 deaths. And this is our epic curve, CMO was just showing you. So this is for Sarah, Southeast. So if we notice here in April, this increase here, that was our Alarica cluster in St. Catherine. And we look down here again, and we're starting up in June when we open our borders and we started having some imported cases coming along. And then by the end of July, entering into August, we had the outbreak in St. Thomas. And then Emancipation Day, and then followed by that, then we saw a spike in cases. And then we had independence, we had the elections and the nomination days, and all the other activities would have seen us increasing in our numbers. We started to go down, and towards the end, we spike again, and that is resulting from another cluster. So if we look at KSA, which is a similar picture over period, of importance, this final spike here would have been in relation to the cluster in the home downtown. For St. Catherine, as we said earlier, this spike area is the Alarica cluster in April. And then, of course, they had their portion of imported cases due to the opening of the borders. And coming across, it is the same picture, the similar picture of the Emancipation Day and all the other activities leading down. The numbers are trending down somewhat, but there's still cause for concern. And of course, St. Thomas has the prettiest picture. St. Thomas started off very, very quiet, started to increase as they had 1 and 2 of the imported cases. And then, of course, we know around the end of July, the beginning of August, the large outbreak that has caused us to have a lockdown in that parish. And we would have employed a number of strategies and activities to ensure and to achieve what we have achieved, just 4 cases now. The cases that we have, confirmed cases, we find that the burden of cases are with females. So we would have had quite a significant number of female compared to males. 3,192 females compared to 2,589 males. If we look at the age group, we would also see that the age group that is most affected is the age group 16 to 65 years. That is the area where we have the greatest number of cases. We would have also had several clustering. And the most recent cluster, we had 10 clusters for the period. The most recent cluster being the Missionary of the Poor, the Golden Age Home, and quite a few of the Golden Age Home cases have recovered. So we're doing very well at that home, and we're hoping to do the same with the Missionaries of the Poor. We'll continue to monitor it, close monitoring, and given the support that is needed to ensure that the cases recover without too much challenge. Now we're looking at our deaths. And if we look at the deaths, we'll see that the largest portion of the deaths are amongst the age 70 to 79, where we have 29% of our deaths. But if we want to look wider, we could see from the 50 to 89 age group would have covered approximately little over 70% of all the deaths. So these are very vulnerable age group. And of course, the comorbid conditions also expose you to deaths. Now, this is just a map of Kingston and St. Andrew, which would see Kingston and St. Andrew with a number of cases scattered all over. But of importance, there are just two areas where we see very, very dark. And one of the area would be the downtown area, and that would be related to the recent cluster in the home that we had. Also, we need to take a closer look at what's happening in Franklin Town. For St. Catherine, we see St. Catherine has cases almost over the entire map. It is very, very widespread. And areas of concern, we have quite a few cases in the Greater Portmore, Gregory Park area. Though it looks so dark, the cases are scattered. We all know that Greater Portmore is a very vast area, and so the cases are scattered in the different areas. So there's no real clustering in Greater Portmore, even though we see the area quite dark here. There is also Linstead, that is a little dark here, but the cases in Linstead also are scattered throughout. So we don't have any area of clustering in that area. Watermount is coming up. And so we have to be continuously doing our surveillance, our education, ensuring that we're catching these cases early, testing them, and so we can isolate early and quarantine and ensure that the spread is detained and it does not extend. Now, if we look at St. Thomas, it's a breath of fresh air. St. Thomas only has 4 active cases, but it was never always this way. I'm just going to show you a little picture of how St. Thomas evolved. So if we look at the cases in St. Thomas, you will see that over time, they would have had more than their fair share of cases. But because they have worked hard, they have managed to contain and reduce the cases. Doing our prompt contact tracing, isolation, quarantining, testing, ensuring that these cases do not spread. So if you look at it, the entire map of St. Thomas, I think St. Thomas is encouraging, and we need to take a page from their book. Granted, it is very small, so they are able to deal with it. Casey and St. Catherine are pretty large, and so a little bit more challenges. And so for the period of the outbreak, the region, along with the Ministry of Health, would have employed a number of strategies to fight this pandemic. And our strategies would have evolved based on the evolution of the pandemic. And as we learn more about the pandemic, we are able to change our strategies and add new strategies. So we would have been doing a lot of health screening and quarantining of persons who would have arrived through our ports, both airport and seaport, public education and sensitization of the public and our vulnerable population. We would have had a community quarantine, and St. Thomas did have that, which worked very, very well there. Promotion of mask wearing, sanitization of hands and frequently touched surfaces, and social distancing. We'd have strengthened our secondary care capabilities. We would have increased our bed capacity in hospitals, our ventilatory capacity, equipment supply, personal protective equipment, and the creation of step-down facilities for persons who need to be isolated but don't necessarily need to be in a hospital setting. We would have also have isolation quarantine facility, and we would be building the capacity over time of our healthcare workers, so we would be more comfortable, we'd be more knowledgeable, we'd be more able to deal with the cases as they come. We'll be facilitating also mental health support for staff, because burnout syndrome is very real, and the patients also are suffering from mental health challenges, and so we would have provided the necessary support as is necessary. There's also environmental health inspection and enforcement of regulations for institutions, food handling establishments, school, business places, and infirmaries. Testing, diagnosing and contact tracing, isolating and quarantine to slow the spread. Community surveillance to identify symptomatic and vulnerable. A lot of health promotion has been taking place. We've been training and sensitizing different persons, different areas, workplaces, school, targeted community, both face-to-face and via social media platform. Dissemination of messages, speaking to sensitization, sanitization, mask wearing, and social distancing. We would have utilized town criers also to help spread some messages. Distribution of education material related to COVID-19 to schools, businesses, workplaces, health centers, bus park, and everywhere we can find somebody, we will give it to them. We have even visited the coronation markets and the plazas. We were at all those places distributing and speaking and engaging the public. We would have had focus group discussion with different age cohort were conducted for risk assessment and COVID, because as you know, everyone have different perceptions out there about COVID, and we need to know, how do you see yourself susceptible, or why don't you think you're susceptible, so that we'll be able to put in the necessary strategies to combat, to educate, and to facilitate the cooperation of the public. Public relations videos were also developed, newsletter, publication, social media. And I just want to take the opportunity at this time to just encourage our public to adhere to the protocol, please. Do not have your backyard parties. Bars, do not close your front door and open your side door and entertain above the recommended numbers. Too much of these crowd gatherings are happening, and this is only making the situation worse. Please help us to slow the spread of COVID. Wear your mask whenever you're in public spaces. Sanitize your hand regularly. Sanitizer is not a substitute for soap and water. So use soap and water as much as possible. If it is not available, then use a sanitizer, but keep your hands clean and frequently touch areas clean. Sanitize, sanitize. St. Thomas would have done a lot of work hard work, days and nights, sleepless night, to have achieved the success that they have achieved. So help us to keep Jamaica safe. Thank you.
Thank you very much, Dr. Sandra Chambers. Thanks for that very thorough presentation. It's very, very encouraging. You said some things which is worth echoing. You said St. Thomas is a pretty picture, and I want to echo that. You also said St. Thomas is a breath of fresh air, and I want to echo that also, because what you're basically saying is it is worth highlighting St. Thomas. It is a case study of having a high level of threat or risk and managing that risk. And of course, we have to recognize the team, the public health team on the ground in Sarah, in St. Thomas, and also, of course, the supporting teams from the front line, the constabulary, and of course, we can't forget the citizens of the parish. So really want to big up St. Thomas, and your presentation echoes the successes that they have had, and we encourage others to follow suit. But you also said something that is that ties into what the CMO said earlier, worth noting. One, you spoke about the burden of cases, where you said women were more affected, at least in the Sierra region, and I suspect across the board, in terms of positive cases. But then men had the highest fatality rates, and that is saying a lot. I mean, it's certainly saying that our women have been more exposed for one reason or the other. And we know we have had the cluster like Alarica, which was 300 plus, but that would still not account for the difference between women and men in terms of positivity rate. But we also can conclude that our men are less resilient, in other words, are less able to manage the COVID, which means that their own health profile as individuals is a risk, is a challenge, and is something that we have to work on in a more broader context. I will say to our listeners in the COVID conversation we're having here that over time we have to move the conversation from COVID to our comorbidities or NCDs and the rate of NCDs in our population, because the truth is our vulnerable population tends to be those who are not in a state of fitness, not necessarily physically fitness, even though that's important, but overall fitness in terms of their physical state. And that has a lot to do with lifestyle, which we will revisit and have a conversation on later on. Quickly now, in terms of update on our vulnerable communities, I just want to mention our prison population. The prison population sampling at these facilities has yielded 39 positives among inmates, with only 2 active cases currently and 394 negatives. So I think we are making progress in terms of our prison population. 54 staff members have tested positive, with only 3 active cases currently and 141 negative. So that's a quick update on our prison population based on the outbreaks that we have reported on. I reported in Parliament on missionaries of the poor, and the situation remains the same. Just looking at the information here, in the interest of time, I won't go over unless questions are asked. But I think we continue to manage that process fairly well, and we're encouraged by what is happening in terms of the treatment and the response. I actually visited the facility yesterday with the team and the Raytown area, and I think a lot is being done there. In terms of Raytown, we're very encouraged. 773 householders visited, 1,062 persons reached, 1,249 pieces of IEC material distributed, that is public education material, 112 samples taken with 0 positives and no results pending. So Raytown looks very encouraging, and thanks to the citizens for their cooperation and the team on the ground. It does point to a direction where we could lift, or certainly recommend the lifting of the quarantine measures, and that's positive. So we're in a good place as it relates to Raytown. In Cornwall Courts in St. James, I visited last week. Some 1,149 premises have been visited to date, with 1,836 persons reached, 167 entities inspected, with 51% found to be unsatisfactory. And I am assuming that this 167 are public premises with business places, 51% found to be unsatisfactory. And we continue to encourage entities that deal with the public to put in place the systems that represents the protocol, the hand washing stations, sanitization stations, the mask wearing for entering, the consistent cleaning. It's not sufficient to have in this inspection at least half of these entities not having what needs to be had. And we want to encourage that, and we will be continuing the inspections, and where necessary we'll cite persons when they're in breach. 1,497 health education material distributed in the business district, over 4,000 persons engaged. To date, we have had 17 cases that have been identified in the Cornwall Court area, with 14 still active, and 59 persons have recovered, and 1 person unfortunately has died. So the data of 17 cases identified, 14 still active, 59 recovered, and 1 unfortunate death in the Cornwall quarantine community of Cornwall Court in St. James. Again, reminding all to continue to cooperate and to stick with the protocols. Now we turn to St. Thomas quickly as we go into a conversation. We have heard that St. Thomas does look pretty and is a breath of fresh air in terms of its response, according to Dr. Chambers. And, in a sense, we wanted to highlight St. Thomas because it represents for us the possibility of a best practices in the COVID national response. And it's about looking at recovery, because at the end of the day, we are doing all of this to recover, to restore normality, to secure our population. And we must highlight when there are positives, just as we are transparent about the negatives or the challenges. So I want to begin by thanking a range of interventions conducted, or those who managed the interventions during the quarantine of sections of the parish. While St. Thomas has seen some 400 COVID-19 cases since the pandemic's first visited Jamaica's shores in March, as at November 3rd, 4 persons have died, which is very unfortunate, and we continue to express our condolences to their family members and friends. There are currently only, however, 4 active cases in the parish of St. Thomas, and I believe the population of St. Thomas is just over 100,000. How did we do it? We were deliberate, and I say we here, meaning the public health team, the supporting agencies, the government of the day in declaring the restrictions that were necessary, the police, the community leaders, the Ministry of Labor through the welfare packages that were handed out. So when I say we, I mean all of us. And this is really the theme that we want to capture and reinforce. So we were deliberate, we were consistent, we collaborated, and we ensured that the people knew their health was our priority, and the people cooperated in their own interests. And again, all of this represents a part of the solution. The interventions that were specific to St. Thomas, some outlined earlier: establishment of the Emergency Operations Center with dynamic roles and functions responsive to the emergent needs of the parish. So it really was assessing the particular circumstances around that parish. If you're going to shut sections of the community down, do they have shops in the area to service their needs? Do we bring in mobile units, which we did? Other forms of critical intervention to keep persons relatively comfortable while we did our checks. Included in the activities of the EOC was daily planning for the next day's activity, which included the designation of persons into teams for the various field locations, timely case identification with the removal of cases from their homes and communities as appropriate to slow transmission. So we had to extract from the population persons who would have been affected and did not have the ideal circumstances and therefore would become a threat to others. Screening at health centers with the identification of persons suspected of COVID-19 seen separately and their samples taken for testing. Contact tracing, which continues to be an important part of the intervention. Upon identification of positive cases, contact tracing teams are dispatched within 24 hours to conduct case investigations. Among other things, the teams conducted home assessment to determine the suitability for quarantining at home, because your home environment is not always most appropriate, particularly in the sort of urban centers, the inner city spaces where persons lived in less than ideal circumstances because of the rate of poverty in those areas, lack of amenities. If 30 persons are in a house sharing the same facilities, then it becomes a risk to all concerned. So that kind of assessment had to be done. And community surveillance was done to identify positive cases through house-to-house surveillance. Fever surveillance in quarantine areas, we did temperature checks, and that is an ongoing effort. That's the first sign that there is an issue if you have an elevated temperature. And among other things, we also engage in parish restrictions or curfews, which enabled isolation and did extensive health promotion and education on the ground. So I'm aware that many Jamaicans, ladies and gentlemen, as we reflect on St. Thomas, are put under, are stressed or weary or suffering from COVID fatigue as they are placed under quarantine arrangements. Indeed, the entire country is restricted, as we all know, from the restrictions or curfews. However, quarantining does work, and I think St. Thomas is an indication of that, and indeed the country, based on what we're seeing with the numbers now, is an indication of that. It allows us to go in and to engage in a targeted way the various community stakeholders and to do what it takes to slow the transmission. Slowing the transmission is critical because, one, we recognize that you're not going to eliminate it because there are too many margins of error. It is too much of a highly contagious virus. But what you have to guard against is your public health system being overwhelmed, and you cannot treat persons who need treatment. For us, we are not and have never up to this point been threatened by an overwhelmed public health system. In any event, we would have had stresses on particular institutions, but we move around persons and we continue to have spare capacity, which is a very positive thing. Indeed, today, I believe we had more ventilators arriving in the country. We have had a reason to use as many, and we celebrate that. But we have more that have come in just in case we need it. This is according to the National Health Fund CEO who spoke to me earlier today. The results of the St. Thomas quarantine efforts, not only do we have the opportunity to detect positive cases early through the quarantining, it also provides us the chance to ensure that infected persons receive the appropriate clinical intervention for the best possible health outcome. The result of the St. Thomas quarantine efforts is evidence of this. Quarantine orders for the parish were lifted on September 2, with transmission broken. And this again was a celebrated date because of the cooperation, the collaboration of all. So I really want to big up the team in St. Thomas and St. Thomas parishioners for their cooperation, and say to them, they may be a small parish or relatively small by population, but they are now showing an example by virtue of the fact that they were significantly threatened, and they are now in a zone where one could consider St. Thomas a relatively safe space. I say, before I start the interview of Dr. Dwayne Smith, Dr. Smith, Medical Officer of Health for St. Thomas, that the successes doesn't mean we should be complacent. And I urge the citizens of St. Thomas to please continue to observe the protocols. Many of you travel to Kingston for business, for pleasure, for other activities, and therefore we still have exposure because we go in, we go out, we interact. So please continue to wear your mask, continue to be an example for all others to follow. So at this point, I want to bring online Medical Officer of Health for St. Thomas, Dr. Smith, just to get her feedback on St. Thomas. Doctor? Huh? His. Oh, okay, sorry. Doyne Smith. Okay, Dr. Smith, are you on?
Good evening, Minister. Thank you for having us.
Boy, sorry to...
The internet is bad tonight, so please forgive us.
Yes, and let me apologize to you for putting you in a category that you're not. I said her at one stage. Dr. Smith, welcome on to COVID Conversations. I think those listening on would like to know what were the keys to the successes in St. Thomas. You were a big part of that, you and your team. Just tell us quickly how you overcome the challenge in your own words. Okay, I think we're having a little technical issue there. Can you try to get him back for me, please? So Dr. Smith would have been a critical part of the coordination of efforts on the ground in St. Thomas. He's there every day. He champions the public health response from a clinical perspective. And when we had the outbreak in St. Thomas, he would be the person who have detected and would be on the ground. Dr. Smith, are you back on?
Yes, Minister. Sorry about that.
All right, before we lose you again, tell us quickly.
Present.
Tell us quickly how you did it and how the team worked.
Well, as you mentioned, teamwork was the aim of it all because we all have different strengths, and so we capitalized on that. And one of the critical things was the community being involved. People giving us information as to whether there are suspect cases, persons with symptoms, that made a world of difference. And isolation of individuals, as soon as we identified them, made a big difference. And that needed facilities to isolate in. We were fortunate enough to have the Marabella facility in which to isolate. We also did contact tracing, case identification very early. And that's one of the things I have to commend the team on, because they were constantly going day and night, getting these persons recognized and treated, and so that we could contain it. Particularly when we had to quarantine the Church Corner, Summit, Bamboo River area, we really had to work day and night to get that situation contained, where there were individuals that we had to work with the police, the Ministry of Labor and Social Security, SDC, to ensure that these individuals were taken out of the community and placed in a quarantine area.
Okay, have we lost him again? So the teamwork he's saying was absolutely critical, which we echoed earlier. The fact that persons were extracted from the environment and they cooperated, because we have had cases where persons did not cooperate when we were attempting to move them out of the environment. And so that represented a challenge, but seems to have worked. In this case, I think we're getting him back momentarily, but it worked. Dr. Smith, you're on again. Could you?
Yes, Minister. I'm back.
Okay, we're using the phone now. So continue quickly.
Hello?
Go ahead.
Oh, yes. So in terms of the interventions for the parish, the partnerships with the other agencies were really critical, as we're mentioning, Ministry of Labor and Social Security, SDC, the Parish Disaster Committee. All of us worked together, and the Jamaica Constabulary Force was really, really a big partner for us, particularly in us establishing those quarantine areas and along with the Jamaica Defense Force. However, in terms of getting the positives out of the community, which was super critical, as Minister has mentioned, we needed the police to be there with us because we went into areas that were not necessarily the easiest and most compliant areas. And we took out those individuals who had poor home conditions for isolation, had them in facilities. When we ran out of space in facilities, we were fortunate enough that out of parish, there were areas that we could, and the Western region and the Kingston and St. Andrew Health Department also helped us to facilitate these. One of the critical things, though, I find for St. Thomas is that there was a lot of community involvement. in the sense that persons actually were willing to call to say, I noticed this person, which, gave us early information so we could intervene. So, that made a big difference. And our facilities being able to isolate sick cases was very critical, particularly with the hospital itself having a refurbished ward that was now going to be the COVID ward, which gave us the capacity of 9 and an additional 3 beds in an additional isolation ward. So we actually have been very fortunate. We've had the full support of the ministry for the entire time, particularly the minister being on board the entire way. We've got the epidemiology support. We've got the full backing for everything. So we managed to do this not just by ourselves, but as a whole team. And the community members played a big role.
Dr. Smith, 2 quick questions, or 1 double-barrel question. What would you identify as this most significant challenge you face? How did you overcome? And finally, what advice would you give to other quarantine communities, both those who live in the communities, but those who are
Sorry,
presiding
Minister,
over?
if you could repeat, it was a little low.
Okay, I was asking just a quick final question. What would have been your most significant challenge, and how would you overcome if you were to identify the most significant? And what advice would you give to other quarantine communities?
Okay, the most significant challenge that we had was persons who were positive being in the community and people moving between the households within a community. So although we had a quarantine area with soldiers within it, persons were moving between the fences, and there were positive persons who were within this that were not yet identified. The only way around this is really through community engagement, involving those persons on the ground, letting them recognize the risk and to understand that we have to have them isolated, we have to have them being reported, and we have to stop people from moving, because they had parties at some locations which the JDF had to go in and stop. So I think it has to really be engagement that does it for the quarantine areas, because you can never police it enough. And so that's what I would say to everybody: engagement of the populace.
All right, and finally, advice to a quarantine community?
For the quarantine communities, I think one of the most important things to recognize is if you comply, then you will have the case reduction and the risk reduction. And that is really the major thing we have to do. We will provide you with food, because that's one of the concerns a number of persons had initially. But through our partnerships with MLSS, we're able to provide food for every person, and we did that every 3 days or so within the quarantine areas. And so people just need to comply. You will not be without all of your needs. We provide the pharmaceutical needs also, because there's a partnership with the National Health Fund, where every 3 days, essentially, you can have your prescriptions filled for the different ailments that exist. So compliance with the quarantine orders, and it will result in a reduction in the number of cases and the safety of your community, so you can return to normal life.
Dr. Smith, thank you very much, and please give our regards to your team. Big them up for us this year, and we're very proud of the efforts in the parish of St. Thomas, and we encourage you and the team and the citizens to continue. God bless. Thank you very much. At this point, we're going to move now to look at the partnership between ourselves and the Jamaica Constabulary Force that was referenced by Dr. Smith. Deputy Superintendent of Police Fitzroy Williams, also from St. Thomas, where a lot had to be done on the ground, and maintaining order in these unusual times was very important. The JDF was a critical part, but the police also played an important role. Is DSP Williams online? Deputy Superintendent, how are you? DSP, are you hearing me? No? All right. So the police continues to be and the Ministry of National Security through the Minister Chang, continues to be a very important part of our COVID response. And the question that, we would like to explore are, what's the role of the police during a quarantine period? I mean, we know, but I think the public should know. And how do they themselves, they are frontline workers, too, even though they are not medical workers, they are exposed to the virus in the community, having been placed there and have to stay there and interact with persons there. Is he online now? DSP Williams, welcome to COVID Conversations. Steve, I think you need to use your phone again. All right, so we're having some technical issues. Is he coming live from St. Thomas? Okay, so we're going to use the phone instead, as we had to do with Dr. Williams. Okay, DSP, are you online now?
Yes, sir, I'm here.
Okay, excellent. Thank you for coming on to COVID Conversations. First of all, thank you for your service, and to you and your members. Just a quick expose of the role of the police in a quarantine zone, with St. Thomas being the reference, and, just so that the public understands what your role is. Quickly, thanks.
All right, thank you again. So, let me just take the opportunity to say thanks for having us here. With the help of the external support at headquarters level, we were able to put together our UPSADA, all in line with the good and support of the Jamaica Defense Force in terms of security personnel. We were able to work along with the ministry, with the St. Thomas team in keeping the quarantine zone, and when it was extended into Albion and Seaford, it was a stretch for us, so the military had to come very much on board. So we were able to have two shifts and be consistent. Let me just say that what we found that whenever we were able to identify a person would call either the health ministry or the police, we found that we were given that support. And when the community person see that the police and the Ministry of Health were working in tandem, I think they realized that from early that then most definitely there's not a divide or anyone is going to let up on having the spread of the virus in the parish. We had what to do our thing outside of the days of the ministry, where with the partying and all of that. We continued to pursue them. Just Thursday ago, we had to close down a bar in Bull Bay, and we are able to move along also with whenever the shift in the lockdown. The Sunday and the holiday of the other day, the 19th, we were out there early and letting persons know that outside of the hours, we're entertaining our parish, just moving about freely like that. So the truth is, we are able to lend that support whenever the team from the hospital call or from the health anywhere get the information, we're able to move quickly, albeit we go and give some support. And community policing, it is not happening in a great way. So wherever the gathering is at, if it's at the Western Union, if it's at the bank, wherever, we seek the opportunity to use the opportunity to remind the public that, we are at risk and we have to be careful of what we allow and ignore. So
yes.
we are.
DSP, I wanted to ask you quickly,
yes, sir.
Your members, I mean, you certainly have to deal with your own fears and anxiety while executing your duties on the ground. How do you cope with that and just sort of provide the leadership to reassure your members? Because sometimes we forget that the people on the front line have their own issues, their own families, their own self to protect. How has it been in the case of St. Thomas?
I think initially there was some drawback, but I guess with good leadership and leading from the front, all managers from the St. Thomas, whenever we hear, we would go along. And having the ministry there as being the expert, call it that, I think that also give us the police on the ground, that's confidence to give their support. We were also ensuring that we don't just wait on the ministry to give us that go ahead. What we do is respond early whenever we get information and go and insist. There are some gentle persuasion that we have to use, and there are cases where we remind them of their breaching the law. It's a risky job wherever you take it, and as I say initially, the members were a bit drab up, but most members, most of the members live in the parish, Minister, so they have a duty to protect the parish, and as such, it comes outside of just being a job. It's just something that they have to do to protect the parish.
Well, again, I want to thank you, DSP Fitzroy Williams. Thank you and your members for the role that you have played. You are a critical partner, as well as the JDF and so many others, and we continue to celebrate the efforts and the collaboration. Thank you very much. Have a good evening.
Yes, sir. Thank you very much for having me.
And then before we get to our questions, I'm sure there are a few questions that the media will have. I want to go now to a resident quickly from St. Thomas. Resident we will refer to as Resident A from Port Morant in St. Thomas. She has recovered from COVID-19, and we're going to ask her to share her story. She is a community influencer and was there on the ground and had to be treated, having picked up the virus. Is she online? Resident A, good evening to you.
Good evening to you as well, Minister.
Well, first of all, happy to hear you and to hear that you are recovered and back fully, as well as so many other members in your parish. Tell us a little about your experience with COVID-19, firstly, and then a little bit about how you view what transpired in the parish or in your community. How was your personal experience?
I must commend the team at the Princess Margaret Hospital. I was tested very early. On the Saturday morning, we noticed a team at my neighbor's house, and by the following day, there was a team within the community doing random sampling and targeted sampling at the time. From that, I was picked up and I was brought to the hospital, isolated for just over 5 days. I had underlying conditions. Those were treated, dealt with, and then I had the facilities at home to home quarantine. And so I was released back to home under their constant supervision, 2-3 calls per day, just monitoring whatever it was that I was doing.
Right. So how did that make you feel, knowing that you were being monitored even from home, not just in the hospital?
I have small children, and so it reassured me if I had questions, I could call them. I was reassured that I was on the right path. I was not exposing my children and that I was not exposing my friends. Really, it was just a case of do what needs to be done so that we can get this behind us and move on with life.
Were you ever stigmatized at all? Stigma has been a big part of the sort of block to supporting the COVID response.
I personally never had that experience. The persons around me were extremely supportive. My circle of friends were supportive, and nobody really behaved in a manner that would make you feel untoward. And I think that is what has worked for St. Thomas. It has not been stigmatized, and so persons are not prone to hide whatever symptoms they're having, because they know that even if you're declared COVID positive, once you have the support of not just the medical personnel, but the team of persons within your community, you can, once you're declared fit, you can still go to the shop, you can still interact with persons. It gives you a freedom that probably some other persons in other parishes don't have. And I think that is one of the things that has worked for St. Thomas.
Very happy to hear about the stigma, or certainly the breaking down of that, because that was a big issue in the early stages. And I think that persons like yourself, I understand you're a community influencer. What sort of advice and what role do you see yourself playing, having gone through this experience, whether in your community or beyond, as we seek to overcome this issue? And what advice would you give to others?
One of the things I recognized from having been in isolation for some time is that it's an experience that you really don't want to be experienced by any and everyone. It is challenging. And so one of the things that I do, I remind persons around me to wear their mask. I always have my spare hand sanitizer to help out, just in case somebody else doesn't have theirs. The ministry polices the church and our social gatherings. And so my advice to persons is follow the rules as much as you can. Where you are having challenges, seek assistance, seek help, and do what needs to be done, because at the end of the day, COVID is not going anywhere and we have to live with it.
Well, I want to really thank you, Resident A from Port Morant in St. Thomas. You came across very confident, very appreciative of the support you receive, and clearly as a community influencer, community leader, you sound resolute to also provide support, which is what we need. It really is everybody's business, and we really have to project a sense of togetherness on this. We're all at risk, or we're all safe, depending on what we do as individuals and also collectively. So thank you very much. Congrats again, and big up to yourself and all the residents of St. Thomas. St. Thomas.
Thank you as well, Minister, and St. Thomas will continue to do our best.
Very good to know. Thank you very much. All right. Well, I think we've had a good conversation on St. Thomas. As was said earlier, St. Thomas looks pretty and is a breath of fresh air. Big up to St. Thomas. And we're going to go right now into our questions. And so I'll hand over to Stephen.
Thanks very much, Minister. Just inviting our media colleagues to use the raised hand feature on Zoom to ask your questions. And I'll begin with Brittany Clark from Nationwide.
All right, good evening, everyone. I just have one question. Could you provide the details on the level of readiness of the 17 participating schools in the pilot face-to-face reopening of schools? And that's with regard to the Ministry of Health's COVID-19 guidelines. So I just want to know if there's been a thorough assessment and what were the results from that assessment. Thank you.
All right, I'm just going to ask the CMO to speak generally to the protocols around the school system. I don't think she has before her the specifics of the 17 schools, and I think that should suffice. If you need further details, we can follow up this week, later on this week. CMO.
Hi, good evening, Brittany. Well, we have been working with the Ministry of Education in the parishes, our medical officers of health and our public health inspection teams have been in the schools and they have been doing their inspections. Some of those have been completed, I know. Some of them will require revisits because there are some things that need to be tweaked in order to make it ready. So I know that we're active out there and we're working with the Ministry of Education to ensure that everything goes well when we start.
And the protocols are not much different from the protocols that we would promote nationally around the mask wearing, the physical distancing, the cleaning and deep cleaning and the sanitizing. I have visited a number of schools as in my other life as a political representative in a constituency. And, there is a deliberate effort, even in those other schools that are not part of the 17, with the principals and others, including the ministry, to demarcate or to recognize spaces for, how you standing aligned with the space. So they actually markers on the ground. There are more hand washing stations around the schools, all of this in aid of respecting the protocols around the virus or controlling the virus or minimizing the risk of spread. So those 17 schools, as was outlined by the Minister of Education, I think a week ago, in a formula that she presented, working with us to show the least risky entities, would have captured, if you will, most of those protocols in a way that allows them to function while minimizing the risks. And that's the basis on which they were selected. Thank you.
Thank you very much, Minister. We're going to go to Cassius Watson from Jamaica Social.
Hi, good evening, folks. Are you hearing me?
Yes, go ahead, please.
Okay. I just want to focus on the matter of, or on the topic of deaths. I've been noticing, watching these numbers as they're coming daily or reported by you daily. And I'm curious as to sometimes, and many times, many occasions, you see that you see no effects of the deaths regarding people who are moderately ill or persons who are critically ill? Is it a situation where people are presenting at the hospitals in the emergency rooms undying or in a very bad state? Are you seeing a lot of that? Because sometimes you'll see 3-4 people dead, and these weren't cases that were previously investigated. But we're seeing these numbers, and I'm curious as to where these deaths are coming from, because they're not reflecting in your hospitalizations.
I'm going to ask the CMO to, I don't share that view, but I'm going to ask the CMO to respond.
We would have provided an update previously on the deaths. I don't have an update today, but previously we would have reported that we would have had persons that would have been brought in dead. We would have had persons that would have died within 24 hours of presenting to hospital, and then we would have had the cases that we would have been monitoring that some would have died. So I know we have given a previous report, but I totally agree with you that we can provide an update in terms of what's happening now. So perhaps, Minister, for the next meeting, for the next press brief, we can provide that update on the details of the deaths.
Yeah, just to add to that, though, that the extent of deaths reported versus the hospitalizations that we have would reconcile or certainly justify the likelihood of someone passing. I mean, we've right now we have probably a third of our hospital beds, COVID beds that is, that are occupied. At least the last time I checked, something like just over 100. And the way the virus functions in terms of the capacity to become more, have impact, to transition from being moderate to critical or severe, is very unpredictable. And persons, if you speak to the doctors, they'll tell you that persons can move very quickly from being moderate to very critical. I think the CMO is correct. We could provide some details, better particulars for better understanding. But just to say, it is entirely possible for someone in a hospital setting being moderate today and being severe tomorrow, depending on comorbidities and several other factors. So it is likely what would have played out, separate and apart from those who turn up, who are already in a severe state. And we have had those cases also.
Thank you very much, Minister. I think we have a follow-up from Cassius.
Yes, I know that you're explaining, it's kind of now making sense that the person would have rapidly transitioned to another state. But I'm saying, when you look at because all you give us, you no longer give us a report, you give us just figures and stats. And, at times, you just see deaths. But when you look down at the bottom of the chart, you're not seeing, you're seeing deaths, but you're not seeing, when you compare it from the day before, persons who critically ill numbers going down, or the moderately ill numbers. So I was just curious as to, are these people that were trying to battle the virus at home and then show up at last minute and expired at the hospital? Those type of scenarios. That's what I wanted some clarification on. Thanks.
Okay, thank you very much.
Thanks very much. I think that's all the questions that we have for today, Minister. So I'll hand back to you for your closing remarks.
Okay, I'm going to ask the CMO who wants to make a few comments too.
Right. I just have a few comments. One is in terms of stigma. The minister has mentioned that before, but I just want to say that in our community activities that we have been doing over the last couple of weeks, our team members have been faced with the issue of stigma, with persons refusing to be tested because they have been threatened. Persons who have been tested have been told, don't bother, make it come back positive. So we are still facing that issue, and it is not allowing us to get a good handle of what is happening in some of these communities that we have gone into, because persons are not coming out to be tested. So I just want to make an appeal to the public. Remember that it is a good thing when your community is selected for intervention, because there's a recognition that there is a problem, and what it is that we want to do is to prevent that problem from getting worse. So when the public health team comes in, we should try to facilitate them as much as possible, because it is in your interest and in the interest of all the persons within that community for us to detect any cases quickly, so that we can isolate those persons and be able to protect the rest of the community. So I want to encourage persons to cooperate and to come out for testing when we are in those communities. The second thing I want to comment about is the in terms of the laboratory process. I recognize that many persons are going straight to some facilities to have testing done. They do not have an interaction with a doctor. And so what is happening is that we may have persons who have symptoms that are going straight to laboratories or other places, having tests done, and then present at the health department or to the health department with a positive test. Now, testing is a part of a management of a case. And there are a lot of things that can occur before we get back a positive or a negative test result. And those things need to be put in right away. So if persons are having signs or symptoms, then they should visit their doctor if those are not improving. And if they are required to do a test, there are certain things that the doctors will instruct them to do even before they get the test result if they are a suspected case. And I want to encourage persons to follow this process, because we are also having the situation that persons are getting back a positive test and choose not to report. And we need to have information if it is that we are going to be able to manage this public health emergency that we are in. It is also very important that any facility that has been approved by the ministry, that they do a report and send it into the ministry, because we need to have the information to be able to plan what it is that is to happen in the various areas where we have positive cases coming from. And it's not good enough only to report positive cases. We need to know the negative cases as well, so that we can really see what the burden of disease is. The third thing I want to mention is, Minister spoke about it earlier, is just in terms of the Christmas season, and that persons need to be aware that while it is that we are showing a good positive trend in terms of the numbers going down, that we must be extremely cautious at this time, because there are various situations that are happening in countries around us that will affect what happens here. And so therefore in neighboring countries, we see the numbers going up. In countries where we have persons that travel a lot to Jamaica from, that Jamaicans move freely back and forth, we see the number of cases going up. It means that there is the potential for exposure and the potential for spread. And what we see now can be quickly reversed if persons are not cautious and if they do not adhere to quarantine orders. So I'm making a special appeal to persons to stick to their quarantine orders and to be especially careful at this time. Thank you, Minister.
Thank you very much, CMO, and welcome back again. Ladies and gentlemen, we are now just about an hour and a half or a little less, so we're right on time in terms of the time we'd like to spend on these conversations. I think it has been an interesting discussion. We focused on the parish of St. Thomas specifically, and after giving the national picture. I think St. Thomas deserves recognition and commendation for the efforts of those on the ground, indeed all of the parish, because we needed the participation and support of citizens. A big part of the conversation, I think, has to be our efforts at recovery. We are a resilient people. We are stubborn in our focus, which can be a very good thing and is a very good thing for the most part. We are smart and recognize when we are at risk. And so despite all the challenges around COVID, the fatigue, the mental anguish, the absence of usual or normal activity, the disruption of our culture, we do recognize as a people that all of this is in aid of our own personal health and wellness. And once we pull together with a common understanding, we are better than most, if not better than all. You only need to look around us in other jurisdictions, places that are a lot more developed, economically prosperous, and we see the challenges that they are facing. But in Jamaica, despite the losses, and we regret those losses, despite the challenges around restrictions, we are up to the task, and as St. Thomas has shown, willing to make the sacrifices. And I assure you that it is well worth it. It is worth it because it means saving lives, it means preserving family members and friends and communities, and it is worth it because we are learning a way of life that will place greater emphasis on our own wellness, which over time could mean longevity and even better quality of life. So I thank you again for your participation, and we recognize St. Thomas's efforts. And again, big up to the frontline workers. Until next Thursday, when we will have another conversation, please stay safe, observe the protocols, and let's work together to overcome COVID-19. Thank you very much.
Three factors can help you make safe choices when you're in an area of widespread COVID-19 transmission. Consider the